Hello everyone. The next developmental disturbances of oral and paraoral structure that I will discuss today, that is developmental disturbances of tongue. These are some developmental anomalies associated with tongue like microglossia, macroglossia, ankyloglossia, cleft tongue, fissure tongue, median rhomboid glossitis, benign migratory glossitis, hairy tongue, lingual varices, lingual thyroid nodule. We will discuss one by one. The first developmental disturbances of tongue I will discuss is microglossia. Micro, that means small, glossia means tongue, that means abnormally small tongue. It is an uncommon developmental condition of unknown cause which is characterized by an abnormally small tongue. In rare cases, the entire tongue is missing, that is known as aglossia. Aglossia, that means entire tongue is missing, there is no tongue. Sometimes there is an isolated microglossia, that means only microglossia is there, or sometimes it is associated with overlapping condition that is known as oromandibular limb hypogenesis syndrome. So what is oromandibular limb hypogenesis syndrome? These are some features of this syndrome like hypodactylia, that means absence of digit, hypomelia, that is hypoplasia of part or all the limb is absent. Microglossia is associated with hypoplasia of the mandible. The size of the mandible is less and the lower incisor may be missing. In the picture you see there is a constricted maxilla which is associated with microglossia. So what are the etiological factors for microglossia or the causative factor? Like it is the developmental anomaly, so there is the lack of muscular stimulus between the alveolar arches and these do not develop transversely and the mandible doesn't grow in an anterior direction. That result in a dentoskeletal malocclusion and that result in microglossia. The treatment for microglossia, it depends on the nature and severity of the condition. The main goal for the surgery and orthodontics may improve oral function like your articulation, your mastication, your gestation. These are the normal functions of tongue. Next developmental disturbance of tongue is macroglossia. The other name for macroglossia is tongue hypertrophy, prolapsus of the tongue, enlarged tongue, and pseudomacroglossia. Macroglossia, that means enlargement of tongue. There is a large tongue. It may be caused by a wide variety of conditions that including both congenital malformation and acquired malformation. Congenital and hereditary malformations are like vascular malformation that include your lymphangioma, hemangioma, then hemihyperplasia, cretinism, Beckwith-wiedemann syndrome, Down syndrome, neurofibromatosis, and multiple endocrine neoplasia. The acquired etiological factors like edentulous patient, amyloidosis, myxedema, acromegaly, angioedema, and carcinoma and other tumors. These are some acquired etiological factors for macroglossia. Beckwith-wiedemann syndrome, which is associated with macroglossia. These are some clinical features of this syndrome. First is omphalocele, which is protrusion of part of the intestine through a defect in the abdominal wall of the umbilicus. Then visceromegaly, that is the enlargement of viscerum, gigantism, And individuals with this syndrome, they have an increased risk for several childhood visceral tumors, example, Wilms tumor, adrenal carcinoma and hepatoblastoma. In the picture you see these patients showing some abnormalities in the tongue, that is the macroglossia, and nevus flammeus of the forehead and eyelids, linear indentations of the earlobes, and maxillary hypoplasia. Some authors suggested that this syndrome, it is an autosomal dominant pattern. Some other clinical features of macroglossia or enlarged tongue. In infants, it first manifested by noisy breathing. That is, during breathing, you can feel that is from the nose, then drooling of saliva, then difficulty in eating, lisping of speech, and because of the pressure of the tongue against the mandible, the teeth can produce a crenated lateral border to the tongue. The lateral border of the tongue is not smooth in macroglossia. Because of the teeth, there is a crenated border. Patient showing open bite and mandibular prognathism. So different patient showing different features of macroglossia. For example, patient with hypothyroidism, tongue usually shows a diffuse, smooth and generalized enlargement. In hypothyroidism, the tongue is smooth and there is a generalized enlargement of the tongue. Patient with lymphangioma, the tongue surface is pebbly and it exhibits multiple vesicle-like blades that represent superficial dilated lymphatic channels. Patient with Down syndrome. In the picture you see, that is the picture of Down syndrome. There is a papillary fissured surface of the tongue. Then patient with hemifacial hyperplasia. In those patients, the tongue enlargement is unilateral. The one side of the tongue is enlarged. Then patient with edentulous. Edentulous patient show tongue that appears elevated and tends to spread out laterally. Histopathology of macroglossia or the microscopical features. In Down syndrome or edentulous patients, there is no histological abnormality detected. And due to a tumor, that is due to Wilms tumor, there is a neoplastic proliferation of a particular tissue. That particular tissue can be lymphatic vessel or blood vessel or a neural tissue. Patient with hemihyperplasia and Beckwith-Wiedemann syndrome, there is a muscular enlargement. And patient with amyloidosis, there is an abnormal protein material is deposited among the tongue. Then the treatment plan for macroglossia. The treatment depends upon the cause and severity of the condition. In mild cases, surgical treatment may not be necessary, and the goal of the surgery is to maintain an anatomically and physiologically normal condition. The goal of the surgery is to reduce the size of the tongue. Macroglossia is the enlargement of tongue, so the treatment is to reduce the tongue size and thereby improve the function. The main functions like your articulation, mastication, deglutition, gestation and protection of the airway. So these are all about the developmental disturbances of tongue like your microglossia and macroglossia. So the next video I will discuss about the next developmental disturbance of tongue. So thank you so much.